Hey y'all. All right, so we're going to be talking about FOLFOX treatment for my presentation. This is going to be in relation to colon cancer. So our learning objectives is going to be, for one, to understand FOLFOX treatment and the uses for it. Also, it's going to be to identify side effects and FOLFOX treatment and when to seek medical attention. And then also be able to identify precautions that you would use when having FOLFOX treatment. All right, so the 2023 NCLEX RN test plan that I'm going to be using is the pharmacological and parenteral therapies. Not so much the parenteral part, but definitely the pharmacological. And also the management of care, because now you have this diagnosis, you need to learn how to deal with it. Okay, so let's start with colon cancer. And what is that? So FOLFOX treatment is used for colon cancer, which is a growth of cells that begin in part of the large intestines, also known as the colon. Sometimes this is referred to as colorectal cancer. Typically, it affects older adults, but it can occur at any age. Initially, colon cancer begins as polyps, which are usually not cancerous at first, but it can turn into cancer if they're not found and treated. They don't usually cause symptoms, and that's why doctors would recommend doing regular screening tests. And if the cancer occurs and it's not treated, or if the cancer occurs and it's found, it is treated with surgery, radiation, and or medications. So once you have this diagnosis, some common symptoms that you may find will be changes in your bowel habits that last longer than a week. You can have some rectal bleeding, some abdominal discomfort. You may be feeling as though your bowels don't completely empty after you have the bowel movement. You may also have some weakness or tiredness, and you can lose weight without trying. So that's the gist of what colon cancer is. So what is the FOLFOX treatment? Well, it's a combination of chemotherapy drugs that can treat colon cancer, especially if it spreads beyond the colon. It combines folinic, fluorouracil, and oxaliplatin. Probably didn't say all of those right, but it's a combination of 3 different types of medication. So they can be used alone or as adjuvant treatment, which means that it's used after the primary treatment has occurred, such as surgery to remove the tumor. So when used after the primary treatment, it can prevent the cancer from coming back. Typically, you're prescribed this as a 6-month regimen for those diagnosed with stage 3 colon cancer. Otherwise, they may just receive the Zelox or Capox, which is the oxaliplatin combined with capecitabine. Again, probably not saying those right, but the FOLFOX treatment is most often used to treat colon cancer, but it can also treat pancreatic cancer, which is sometimes used in palliative care. But in this case, it will ease the pain and symptoms to improve the quality of life. Okay, so what are some side effects of using the FOLFOX treatment? They can cause GI issues such as nausea, vomiting, diarrhea. You can have some neurological issues such as a headache, loss of sensation, numbness, or tingling. You can be at increased risk of infection. You can have some dermis issues such as pruritus and rashes. You could also have anemia. You could have some fatigue, ecchymosis, and bleeding, which go hand in hand with anemia. You can have some fever, some dyspnea, dysphagia, and aloplegia. So if these occur, you need to talk with your primary care provider about the medication. They may need to change it up, adjust the dosage, or just continue the treatment if they're not severe. So as we know, as nurses, education is one of the most important things that we do. We do it at discharge, we do it on admission, we do it during the hospital stay. Anytime there's something new or something that changes, we educate the patients on what to expect. So with the FOLFOX regimen, what we are going to educate these patients on is that a central line will likely be placed for the treatment. This is going to allow for a longer time period of the medication administration. It'll be easier access, and it's more reliable than just an IV that you get in the hospital. And it's something that you could be discharged home with for outpatient treatment. So they also need to understand that each treatment cycle is going to run for about 2 weeks. This may last up to 12 cycles. So this is potentially 24 weeks that they may be doing this treatment. In case they have anything planned. So this is going to run for the first 48 hours is going to be the busiest. Cycle day 1, you're going to have aloxapatin through the IV drip. This is going to run for about 2 hours. Then they're going to have the fulinic acid injection, followed by Fluorosil injection and another infusion that will go over a 22-hour period. So the first day, it's going to be basically a 24-hour treatment. Your second day, they're going to have the fulinic acid injection or an infusion that could run over 2 hours as the day before. And they'll also have that Fluorosil injection and an infusion that's going to run over 22 hours. So again, potentially the whole day is going to be consumed by this treatment. However, let them know that days 3 through 14, there will be no treatment until the next cycle. So it's a very busy first 48 hours, but they have the rest of those 2 weeks to just relax. So it's not terrible. We also need to educate them that while taking this medication, they need to avoid cold temperatures and cold objects. So they don't need to drink any cold beverages, no ice with their beverages. They need to drink room temperature or warm beverages if possible. They need to always drink through a straw. They need to cover their skin, their mouth, and their nose if they're going outside into cold temperatures. They need to cover themselves with a blanket while they're receiving their IV infusion at the hospital or the outpatient setting, wherever they are. They need to wear gloves when coming in contact with cold surfaces. They need to drink 2 to 3 quarts of fluid daily unless contraindicated to decrease the risk of constipation with taking these medications. They also need to prevent mouth sores by using a soft bristle toothbrush and rinse their mouth with salt water daily. They may be at increased risk for injury and infection, so they need to avoid contact sports and other people who may be sick. They need to understand that peripheral neuropathy may occur with repeated doses, so they need to monitor themselves for numbness in their fingers and their toes. Tylenol and ibuprofen may be used to help relieve some discomfort while taking this. And they also need to avoid the sun exposure. And if they do go outside, they need to wear an SPF sunscreen of at least 15 or higher. They also need to avoid alcohol and maintain a good nutrition and rest. So these are some of the medications that you may see with this treatment. It may not be the exact packaging, it may not be the exact vial, but you can see the spelling and the name of the medication because I know I butchered how to say them. So, just for reference, this is some things that you may see. Also, they may ask if there's any pre-medications that's required for this. You tell them that no. Typically with FOLFOX treatment, there aren't any standard pre-medications that are required, but typically patients may take a combination of antihistamines and corticosteroids to control some hypersensitivities that may occur from taking the FOLFOX treatment. All right, so because FOLFOX treatment is given for colon cancer, that makes this a chemotherapy drug. So chemotherapy drugs typically come in a bag, such as the one on the right, that is labeled chemo drug. But this is an IV infusion, so likely it'll look like the one on the top left. It'll be a bag with the yellow, sometimes it's red, you'll have the label on it, it'll say chemotherapy, sometimes it'll say handle with care, or give some special instructions on how to handle the medication. So once the medication is received, the packaging that the medication comes in and everything that was used for that specific medication needs to be disposed of differently than a regular medication would. So this yellow bin down at the bottom is typically where you would put chemo drugs, and this would go back to the pharmacy to be disposed of properly. All right, lastly, let's talk about some PPE that will be worn when using or handling chemotherapy drugs. Regular exam gloves like the nitrile or the latex-free gloves, they're not recommended only because they don't protect you from the chemotherapy agents. They are recommended to use the ASTM tested chemotherapy gloves, which is the American Society for Testing of Materials. They are better quality and they're better protection whenever you're coming in contact with the chemotherapy agents. If these are not available, you can double glove your nitrile gloves, but you have to make sure it's doubled, but that's at the very last resort. So when wearing these gloves, if they become visibly soiled, if they break, or they become contaminated with anything other than what you're administering to your patient, they should be removed and discarded promptly. And you have to be very careful to avoid contamination to your hands or your skin or other nearby surfaces when handling these drugs. Also, you should wear a disposable gown. These are like the ones that you would wear for the contact isolation rooms. This will just protect your skin and your clothing from splashes or spills when using these drugs as well. And then in certain situations, eye, face, and respiratory protection may be mandatory. If you feel like you're going to get splashed in the face or the eyes with this medication, it's best to go ahead and wear goggles or a face shield, just to ensure that none of these special agents get onto your skin that can harm you. All right, so that concludes my presentation. Here are a few review questions for you to just reflect on. You don't have to answer them in the comments or anything. It's just to kind of get you thinking about everything that we just learned. So what does the FOLFOX treat? Colon cancer. How many meds are included in this treatment? It's typically 3, but there can be more if you add in the corticosteroids and the antihistamine, or it could be less. And then what are the corticosteroids and the antihistamine meds for? It was to reduce those sensitivity reactions. And then lastly, what are 3 teaching points that you should talk to your patients about? There was a lot of things about cold beverages, not to use or always use a straw, cover your mouth, your eyes when you're going outside, avoid contact sports, and assess for numbness in your fingers and toes. So multiple things that we need to educate our patients on, because as nurses, that is what's really important for us to do for them. All right, well, thank y'all for watching. The next slide is going to be my citations. So feel free to check out some of my resources. Thanks.